By next week, kids age 5 to 11 could be eligible for the COVID-19 vaccine, and many states have already started placing orders for those pediatric vaccine doses to make sure those shots are ready to go out as fast as possible. The FDA could officially sign off on recommendations for Pfizer's pediatric vaccine by tomorrow. Then a CDC committee is set to meet on November 2nd and give a final recommendation shortly after that. With all of this happening over the course of a few days, it might be, a little fast for some people. The time to talk to your child about getting vaccinated is right now. Savannah Levin's joining us in studio this morning with some advice from local experts on how to help kids feel more comfortable about the vaccine.
Yes, we want them to feel comfortable, right? Once the pediatric vaccine gets the green light, the goal is to get as many kids vaccinated as quickly as possible, which is why it's so important to prepare them. Here are some tips.
A lot of times they get really revved up and heightened about the unknown of how bad it could be.
Jody Baumstein is a therapist with Children's Healthcare of Atlanta. She says the time to start talking to your kids about the vaccine is a few days before their appointment. A good rule of thumb is 1 day for every year of life. For example, a 5-day heads up for a 5-year-old. You want them to feel prepared but not be anxious about it for weeks.
As much as possible, try to connect it to what they already know, which is that they've had vaccines before and they've gotten through it.
If your kiddos are afraid of needles, make sure they bring something comforting like a stuffed animal or music. Teach them mindfulness and deep breathing techniques. If they're the inquisitive type, empower them to bring a list of questions to ask the nurse or doctor to ease any worries. Plan a reward for afterwards. We all know the bribery power of ice cream and a movie night. And tell them why they're getting vaccinated. Prepare them with the facts, but not an overwhelming amount. Keep it straightforward and calm.
Reminding them that this is a way that we can keep themselves and we can keep other people safe.
And something as simple as saying the word vaccine instead of the word shot could help with some of that anxiety, which so many parents I know out there know. I know I was a kid, Aisha, who had to be held down by like 5 doctors and nurses. And then once you get it, you're like, oh, that wasn't so bad. And my mom's like, yeah, I'm sure. But that anxiety is a big deal, you know?
It is. And so these were some really good tips to sort of make that conversation a lot less, anxiety fueled. And they're talking about it. You'd be so surprised to know what they know, what they're hearing from their kids, other kids at school. So these are some really good tips, Savannah. Thank you. We have more details on the timeline for COVID-19 vaccines in younger children, plus how the virus is impacting kids in that age group 5 to 11.